Welcome. This is Dr. Strange. On this platform, we teach about different strange diseases and health disorders. And today, we are taking a look at Alkaptonuria. Don't be scared. We'll give you the signs, the symptoms, how it's inherited, and everything you need to know about this disease. Alkaptonuria, or black urine disease, is a very rare inherited disorder that prevents the body fully breaking down two protein building blocks called tyrosine and phenylalanine. They are amino acids. So it results in a buildup of a chemical called homogentisic acid in the body. This can turn urine and parts of the body a dark color and lead to a range of health problems over time. Amino acids are usually broken down in a series of chemical reactions, but in Alkaptonuria, a substance produced along the way, homogentisic acid cannot be broken down any further. This is because the enzyme that normally breaks it down does not work properly. Enzymes are proteins that make chemical reactions happen. One of the earliest signs of the condition is dark-stained nappies, as homogentisic acid causes urine to turn black when exposed to air for a few hours. If this sign is missed or overlooked in a baby or child, the disorder may go unnoticed until adulthood, as there are usually no other noticeable symptoms until the person reaches their late 20s to early 30s. So, when you get to the adult stage of your life, we look at the signs and symptoms. Over the course of many years, homogentisic acid slowly builds up in tissues throughout the body. It can build up in almost any area of the body, including the cartilage, tendons, bones, nails, ears, and the heart. It stains the tissues dark and causes a wide range of problems. Joints and bones can also be affected. So when a person with Alkaptonuria reaches their 30s, they may start to experience joint problems. Typically, they will have lower back pain and stiffness, followed by knee, hip, and shoulder pain. These are the early symptoms of osteoarthritis. Eventually, cartilage, which is a tough, flexible tissue found throughout the body, may become brittle and break, leading to joint and spinal damage. Joint replacement operations may be needed. It can also affect the eyes and the ears. And this is how you know. Many people develop brown or gray spots on the whites of their eyes. Another sign in many adults with Alkaptonuria is thickening of ear cartilage. The cartilage may also look blue, gray, or black. This is called ochronosis. The earwax may be black or reddish brown. It can also affect the skin and nails. Alkaptonuria can result in discolored sweat, which can stain clothes and cause some people to have blue or black speckled areas of skin. Nails may also turn a bluish or brownish color. The skin color changes are most obvious on areas exposed to the sun and where sweat glands are found, which are the cheeks, forehead, armpits, and genital area. It can also cause breathing difficulties. If the bones and muscles around the lungs become stiff, it can prevent the chest expanding and lead to shortness of breath or difficulty in breathing. It can also affect the heart, kidney, and the prostate. Deposits of homogentisic acid around heart valves can cause them to harden and turn brittle and black. Blood vessels can also become stiff and weaken. This can lead to heart diseases and may require heart valve replacements. The deposits can also lead to kidney stones, bladder stones, and prostate stones. So we ask today, how is Alkaptonuria inherited? Each cell in the body contains 23 pairs of chromosomes. These carry the genes you inherit from your parents. One of each pair of chromosomes is inherited from each parent, which means, with the exception of sex chromosome, there are 2 copies of each gene in each cell. The gene involved in Alkaptonuria is the HGD gene. This provides instruction for making an enzyme called homogentisic oxidase, which is needed to break down homogentisic acid. So you need to inherit 2 copies of the faulty HGD gene, one from each parent, to develop Alkaptonuria. The chances of this are slim, very slim, which is why the condition is very rare. So the parents of a person with Alkaptonuria will often only carry 1 copy of the faulty gene themselves, which means they will not have any signs or symptoms of the condition. So we ask today, how is Alkaptonuria managed? We should know that Alkaptonuria is a lifelong condition. There is currently no specific treatment or cure. However, a medicine called nitisinone has shown some promise, and painkillers and lifestyle changes may help you cope with the symptoms. So nitisinone is not licensed for Alkaptonuria. It is offered off-label at the National Alkaptonuria Center, the treatment center for all Alkaptonuria patients based at Royal Liverpool University Hospital. Nitisinone reduces the level of homogentisic acid in the body. Research into its effectiveness for Alkaptonuria is ongoing, and there have been some promising results so far. Also, we must watch our diet. So if the condition is diagnosed in childhood, it may be possible to slow its progression by restricting protein in the diet, as this may reduce levels of tyrosine and phenylalanine in your body. A low protein diet can also be useful in reducing the risk of potential side effects when taking nitisinone for Alkaptonuria during adulthood. Your doctor or dietitian can advise you about this. If Alkaptonuria causes pain and stiffness, we are looking at the exercise part of it now. You may think exercise will make your symptoms worse, but regular gentle exercise can actually help by building muscle and strengthening your joints. Exercise is also good for relieving stress, losing weight, and improving your posture, all of which can ease your symptoms. The AKU Society recommends avoiding exercise that puts additional strain on the joints, such as boxing, football, and rugby, and trying gentle exercises such as yoga, swimming, and pilates instead. Your GP or physiotherapist can help you come up with a suitable exercise plan to follow at home. It's important to follow this plan, as there is a risk the wrong sort of exercise may damage your joints. So you speak to a doctor also about painkillers and other techniques to manage the pain. And also, anybody who is diagnosed with Alkaptonuria can be confusing and overwhelming at first. Like many people with a long-term health condition, those who find out they have Alkaptonuria may feel anxious or depressed. So if you want to talk to anybody, you can visit the AKU Society website. Also, you can carry out a surgery to replace some damaged part of the body, for example, the hips, the knee, and the aortic valve. So people with Alkaptonuria have a normal life expectancy. However, they will usually experience severe symptoms such as pain and loss of movement in the joints, which considerably affect quality of life. Walking and carrying out strenuous physical activity will usually become very difficult, and eventually you may need mobility aids such as a wheelchair to get around. This is a very interesting information. Like and share with your friends, and whatever you have to say concerning this, drop your comments in the comment section, and please don't forget to subscribe to this channel. Thank you very much.